we have David Herzberg, Associate Professor in the Department of History at the University at Buffalo, who is a historian of medicine with a focus on pharmaceuticals. David, I want you to come and tell us all about this. Let's talk about overall hesitancy and the lack of trust that we see with regards to COVID vaccines. And I want you to talk to us about, like, how we got here. Is this familiar to you? Have we been here before?
Yeah, well, yes, we have. Thank you for having me on, first of all. Let me say that for those of us who are excited about the vaccine and excited about the prospect of it bringing COVID to a close, and we got the vaccine at the first possible opportunity, it can seem strange and maybe even a little frightening that there are people who are opposing what seems to us to be a really sensible public health measure. And in some ways, it can be reassuring to know that this, in fact, has happened before, and it has happened a number of times before, sometimes even more intensely than today. So on the one hand, today is not like outside the curve in some apocalyptic way. But on the other hand, that means that there are real issues there, that it's not going to be easily solved just with a few education campaigns. Because vaccines are a medicine that are given to healthy people. It's very different than a usual medical treatment. And that does require a degree of trust between the communities that you're asking to be vaccinated and the people who are giving out the vaccinations. And so particularly in periods where that trust has been low, you've seen intense resistance among some people, a very vocal minority, to vaccination campaigns. Yeah, so for example,
and, okay,
100 years ago, go ahead.
No, go ahead. 100 years ago.
I was going to give an example of campaigns to vaccinate against smallpox. Smallpox, the first vaccination available, and in the late 19th century, early 20th century, campaigns to vaccinate people in major cities like New York when smallpox broke out. They provoked some degree of intense resistance in immigrant neighborhoods in these cities that didn't have a lot of trust of municipal authorities. So that those municipal authorities hadn't been doing a lot of things for them, and they were suspicious of how those people's agenda with regard to their lives, and the resistance could get intense to the point of you go to vaccinate the households near where a case was diagnosed, and they meet you at the door with a rifle. And then in response to this, some of the vaccination mandates at that time could get quite intense in return, using coercion or threat of imprisonment or even violence to get those vaccinations into the arms of those reluctant communities.
Wait, they were threatening to send people to jail if they didn't get the vaccine? Is that what you're saying?
Yes. Well,
can you imagine that happening right now?
Boy, I can sort of imagine it, but I can imagine that the same kind of things might happen in return. Because once again, we have a situation where there is a lack of trust in some communities between the people who need to get the vaccine and the people who want them to get the vaccine. And there are also people who are making political hay and able to pursue agendas by taking advantage of that lack of trust instead of trying to figure out how to repair it.
So let's just call it what it is. I think the irony of all of this, and thank you for talking about trust so much, because Trump essentially trashed trust in all of the public institutions. And it's ironic because he's touting the fact that he created this vaccine, but then completely eroded all the trust with all his people, particularly, a lot of these white people who refused to take the vaccine itself. And, I'm just curious, what can you share with us about this idea of the pushback against the mandates? Mandates are nothing new. They've been around before COVID-19. I was just saying that, in order to send kids to school, there's a mandate that they have to be vaccinated, already to do anything, play sports, go to school, blah, blah, blah. The Supreme Court has also weighed in on this issue before and said that statewide vaccine mandates are in fact constitutional. So here we are, right? We've got 19 states that require state workers to get vaxxed, and 8 of them have some sort of ban or limitation. But for the most part, you got the exceptions for religious or philosophical beliefs, but you got these governors now who are saying we're not going to have mandates and we're banning mandates. Like, I'm confused as to people not recognize history. There's not understanding precedent. Like, how are we here with legislative loopholes, playing a role in all of this?
Yeah, so the vaccine mandates were affirmed by the Supreme Court like 115 years ago, 120 years ago. And basically what they said is, yes, individuals have liberty in the United States, but those liberties are always face restraints and constraints. You're not free to do anything you want at any time. And some those kind of restraints are imposed for the collective good, and they are constitutional when they're not pointed at one particular person or one type of person unequally with the rest, and when they're done in the service of the public good. And so vaccine mandates they're one kind of public health measure that asks people to do something that may be frightening for some people, to take a medicine when you're already healthy. And because people are healthy when they take it, it can also be hard to tell that it has done you right? I mean, you were healthy before you took it, you're healthy after you took it. And so I think it's important to recognize that it is a normal thing to be nervous about something like that. And it's also not necessarily automatically wrong to be suspicious and to kind of advocate for yourself vis-a-vis the kind of pronouncements of social authorities, right? They're not always right all the time. And so you want to have a degree of skepticism, but it has to be a skepticism that can be engaged with, and that you can listen to evidence and try to move your understanding forward. And so
when do we engage with the skeptics?
I'm sorry?
When do we engage with the skeptics, and how?
Well, boy, that is a really difficult question, because in one answer to that is you don't engage in the middle of the emergency. Ideally, you're able to build that trust over time by right behavior. So for example, you're talking with the previous guest about education. Part of that is about learning the facts and understanding statistics and science and this stuff, but part of it is getting to know people who go into the sciences and learning to have trust that they are trying to do what's right. So someone raises a question about vaccine safety. People who do this for a living, they study those questions in the way that you would think to do, and they come up with those answers. Right. And I work at a university. I know those people. Those people are my friends. I know they're good people who are doing their best. Doesn't mean they're infallible, but I know that I can trust them to do this work. And the rest of us, we don't have time to devote our whole lives to researching COVID right now. But so how do you get that trust? That's where you come into things like vaccine mandates. You don't need the mandates if you have trust. If you just tell people, hey, we've got the vaccine and it works. There have been periods of time in the United States history when vaccine mandates didn't meet a lot of resistance. For example, in the period after World War II, when you had developed during the New Deal and during World War II a greater faith in government and government expertise to solve problems and to act collectively, you had the polio vaccine, people lining up around the corner to get that.
Well, I don't know if we're going to get to a time like that where we end up having such a crisis that people, care to have faith in the aftermath. But nonetheless, hopefully we're seeing higher rates of vaccination, and hopefully more people will get on board. David, thank you so much, David Herzberg. We appreciate your historical context here and appreciate you coming on Amplified.